Hello, you're all welcome in my channel. Today we gonna talk about how deep is your vagina and other this you should know about your vagina, but before that hit the subscribe button, turn on the notification bell so that you'll get notified when I post a new video. Thank you. So there are a lot of misconceptions around how the vagina works and how you should be caring for it. Some people think vaginas are a never-ending open space. Not true. Or that it only smells when something's wrong. Also not true. Not sure what's fact or fiction? Keep reading for a list of myths debunked. 1. How long is the vaginal canal? Not that long. On average, the vaginal canal is 3 to 6 inches long. If you need a visual aid, that's roughly the length of your hand. But your vaginal canal can change shape in certain situations, like during sex or childbirth. 2. Does it get longer when you're aroused? When you're having sex, your vaginal canal can get longer to accommodate penetration. Sexual arousal forces your cervix and uterus to lift up and out of the way, which causes the upper 2/3 of your vagina to lengthen. But if you feel a penis or sex toy hitting your cervix, that could mean your body isn't turned on enough to allow for full penetration. Of course, that's not the only reason. Your cervix could be touched when thrusting is too deep, or if a penis or toy is larger than the average penis size. That's about 5 inches when erect. 3. How does it stretch for childbirth? Your vaginal canal and the opening of your vagina will stretch a great deal to allow a baby to pass through. Some women who give birth may notice a change in their vagina, such as it feeling loose or dry, or looking wider than before. You may also feel pain and soreness. This is completely normal. Your vagina should become tighter within a few days after childbirth, and will return somewhat to its rebirth shape about 6 months after delivery. Although your vagina's appearance won't be exactly the same, it'll be pretty close. 4. So the vagina can't get permanently stretched out? No, not at all. That's one major misconception about vaginas. It isn't possible to permanently stretch them out. Vaginas are elastic, so they're able to expand and snap back much like a rubber band. If you do feel your vagina becoming loose over time, it may be the result of one of two scenarios. If your vagina's elasticity weakens, it may not be able to retract completely. This can happen to women who've had multiple births. Aging can also weaken the vaginal muscles, regardless of childbirth. 5. Should I be doing Kegels? Over time, your pelvic floor muscles may weaken as a result of childbirth, surgery, aging, straining from constipation or coughing, weight gain. Kegel exercises can help you strengthen the pelvic floor muscles, which support your bladder, uterus, rectum, and small intestine. They may also help you prevent or control urinary or fecal incontinence. 6. Does the clitoris get bigger, too? Yes. When you're aroused, your clitoris will swell and retract, meaning that it hides under its hood. Your clitoris won't change in size as drastically as a penis does when sexually stimulated, but there's definitely an increase in size. 7. Do all lady parts look the same? Nope, not at all. Your vagina, labia, clitoris, and all other parts of your genitalia are unique. Your labia may be asymmetrical, or your clitoris may be small. The skin in this area may even be lighter or darker than your overall skin color. Although there may be average sizes and shapes, everyone's genitals really are different. 8. Why is the skin down there darker than the rest of me? It's completely normal for the skin of your genitals to be a different color than the rest of you. For example, some women have brown or reddish labia, while others may have pink or purplish labia. Your genitals may also become darker when you're aroused. The blood flow to the area can cause swelling in the color of your clitoris and inner lips, labia minora, to change. But, keep in mind, if your vagina is a chronic purple color, you may be dealing with a yeast infection or chronic irritation of the vulva known as a lichen simplex. If you're worried about the color of your vagina, it's worth making an appointment with your doctor. 9. Is pubic hair really necessary? Whether you have pubic hair comes down to personal preference. It's not actually necessary to the health of your vagina. But there are certain risks from removing pubic hair, depending on the method. For example, you may experience symptoms like razor burn, cuts, or itching if the hair isn't removed properly. 10. Should I douche to keep things clean? Although douching remains a common practice trusted source, doctors recommend that you don't douche. Your vagina cleans itself naturally, so there's no need to go the extra mile. Douching can actually strip your vagina of the natural, healthy microbes, as well as temporarily change the nasal acidity and cause buildup of harmful bacteria. That means your vagina is less susceptible to vaginal infections and sexually transmitted infections, STIs. Thanks for watching. Like, share and subscribe.